Hey everyone, this is Johnny with OhioCannabis.com. I'm in Westlake today at one of Ohio Marijuana Card's offices. I'm here with Dr. Bobby Abrams, and she's been with the company for about a year now. How are you, Doctor?
Wonderful. How are you?
Doing very good, thank you. So this video is sponsored by Ohio Marijuana Card. They have 10 locations throughout Ohio. They have upwards of 14, 15 doctors right now, and I feel has been a very pivotal company here in Ohio to get tens of thousands of patients registered. I mean, it's been a remarkable thing that this company's done.
It has been a remarkable thing. They've been able to spread it out, canvass pretty much the entire state of Ohio, and offer help to everyone and of all ages. Other places I've worked, there have been some restrictions on children, but they've really reached out to people of all ages here to give them relief.
Well, and that is important because I think everyone in the beginning says, it's all about the kids and we want to, help the children. But then we see the numbers, and actually 70% of patients are 50 years old and above. So we're getting a lot of baby boomers for the most part, but you are seeing some kids come through with various ailments.
Usually very serious ailments, seizure disorders, inborn errors of metabolism, where their behavior and their seizures are out of control, and the parents are desperate. So, but I would say our average patient is 60 years of age.
Wow. That's interesting because, everyone's worried about it getting to hands that they're not supposed to, and worried about it getting to the black market in kids, and 70%, that's a big number, and it's good to see that demographics get access to a medicine that obviously is very effective and is something that they probably would have done 2 decades ago if they had the ability.
I think they would have if the stigma wasn't there. The number of people I see that are either they've already been self-medicating because they know it works, or they come in as an absolute last resort in tears and are looking for help and are hopeless. And we're able to give them the hope they need and the treatment they need.
I mean, you guys are seeing all kinds of success and positive remarks back from all the patients, I think, at this point, haven't you?
Totally. I had one patient come in and he wanted to dance. And I danced a few steps. I'm not particularly facile.
He wanted to dance with you.
Yes, and he said, "Do you know why I asked you to dance?" And I said, "Well, I'm guessing you feel well enough." And he said, "I came here about a year ago in a wheelchair.
Wow.
And I'm able to move. I don't have the pain that I have, and my life is back, and my family's life is back."
Seeing it in the micro like that is so important because it's not all rumors or anything. I mean, you're seeing the real success of these people taking a medicine that's working for them to where they can cut out a lot of other things. And not only are they cutting out other medications, their improvement of life is going up better on the medical marijuana than it was on all those various pills.
Without the side effects.
Right.
Without, I always tell my patients, your worst side effect is that you'll get high and that'll go away. Because that's not our goal. Our goal is to improve your quality of life and improve your function. It's not about getting high at all. And I think that's a common misconception.
It is, and I see a lot of people always wanting to go for them high THC strains. They want the 30 or 35%, and personally, I've been using some ones in the mid to low teens, and those have been fine for me. So it's really not all about having the absolute top tier percentage of THC. It's about the balance, and that includes with CBD, I think, too.
I would love to see more CBD in the dispensaries, but my average patient is looking for small amounts of THC so that they can function on a daily basis without pain, without seizures, without glaucoma, without whatever their chronic medical condition is, but it's most commonly pain. And they don't want to be less functional, they want to be more functional.
Right. Yeah, no, those are good insights. Now, this is definitely a different route for you because you said you were an ER doctor for about 32 years. So coming into this, it's easier to breathe probably on a daily basis for you, not having to see, all the mess that happens in the ER. And you're seeing more of the recovery and enhancement of people's lives, I think, on this side.
I am. ER was wonderful because you always felt that you were helping people, but there were numerous people who would come in that you couldn't do anything for. The people with chronic back pain that you just say, look, go see your doctor, best of luck to you. People who are on 4 or 5 different medicines to treat one thing. And now what I'm seeing is I've got one medicine that can treat 3 or 4 different things, and I can lower the medicines they're on, and they don't get the side effects from those medicines anymore. Cost them less money, and they feel less like a patient. They feel more like a human being when they can use a tincture, for instance, and get rid of 4 different pills.
Yeah, that's crazy. And, I know some patients are having issues where their doctors are cutting them off of the other prescriptions if they find out they're on medical marijuana. And it's sad because sometimes you need to balance out the going off those other pills instead of just a cold turkey. And, are you seeing a lot of patients have problems with that?
And I understand that. I've practiced medicine long enough that there was a point where they said there was oligo anesthesia. We're not giving people enough pain meds, and now the pendulum has swung in the opposite direction. And I do see people. I had one woman who was using just CBD, which is non-psychoactive. She was using 2 drops at bedtime to help her sleep, and her doctor refused to see her subsequently.
Wow.
Just threw her right out of the practice, and she'd been in his practice for over 30 years. So I think there's a lot of we need to do to educate the physicians and say this is not about getting high. This works very well in terms of getting people off opioids and doing it in a gradual fashion so that they don't go into withdrawal.
Yeah, those are great points. Ohio requires, I think, only 2 hours for a doctor to go through and get qualified to be an approved medical marijuana doctor. They've had 500 or 600, I think, roughly, that have gone through that qualification, but only maybe half are actually practicing. And at least you see more doctors that are interested in going down that route of learning about it. I just feel that the state probably should implement a little bit more curriculum for the doctors to consume, because I think they would. If you require it, they would have to. But then I think if you offered it more education for a high-level doctor perspective, a lot of doctors would take part in that.
Doctors want to learn. It's our nature. We want to grow and we want to understand things. And I think if you, and 2 credits is nothing. I mean, we often, I think Ohio just changed from 50 to 100 to 50 CME credits. But usually we have dozens of credits that we need to earn. And if you could just educate doctors in the simple aspects of it, they don't have to become experts themselves, but just to understand that it is not about getting high. It is about treating pain. It is about treating chronic conditions. And if doctors are frustrated with their patients who have PTSD, if they're chronic pain, which often results in depression and anxiety, we're happy to see them.
It's a shame that anxiety still hasn't been approved here in Ohio. Anxiety and depression are one of the precursors to PTSD. So it's weird that we have that ailment, but we can't get the 2 precursors when it affects so many people. You can get into the conspiracy theories of is Big Pharma controlling things, which they are, but it's just the anxiety one was really a weird one, because in Ohio alone, there's 1.4 million people that suffer from anxiety, and it's just a huge patient base that we could have here and give people a much better alternative.
Well, and what you're saying is, people will say, I don't want someone driving on marijuana. Well, do you want them driving on their opioids and their Ativan?
Or Xanax?
Yeah, and I just don't see what you're trying to do is use the least amount of marijuana you can to get them the maximal amount of benefit without the high, so that you can function. And to me, marijuana. And the other thing is, things like anxiety and pain are not a static event. They're not the same on a day-to-day basis. So you can vary it very finitely and control it and only use the amount of medication you need, as opposed to one dose fits all.
Right. No, yeah, it is important that patients learn. They have to go through a learning process of realizing how much is right for them, what the proper mixture of THC to CBD works for them, and how often they need to do it. So everyone's going to go through a learning curve, but it's going to be positive for the most part, I think.
Well, and it's true for if I were to put you on an antidepressant, you take it for a certain period of time, you increase it, we might add something else, they might change it. So that's the same thing. You're still going through a learning curve where you're looking at your side effects and trying to get the maximal benefit with the least amount of side effects. We're doing the same thing with marijuana.
Yeah, great point. Now, you've been with Ohio Marijuana Card for almost a year now. But you're new to Ohio because you're from Massachusetts originally, and were you practicing medical marijuana up there?
I was. I started about, I guess I'm about 3 years in now for recommending medical marijuana. And it started when I had a family member ask me about medical marijuana for migraines. And I had every thought that I was going to get on the internet and prove her wrong and say this will not work. And the more I looked into it, the more I realized this is a great idea. In fact, Sir William Osler, the father of internal medicine, wrote a textbook in 1800, and he said the best treatment for migraines was marijuana.
Wow.
So I thought this is information that we've lost. You know, this is information that we had and we used, and now we've lost.
Well, we want to thank you guys for your time right now. Once again, this is Ohio Marijuana Card and Dr. Bobby Abrams in the Westlake office. Right now, they are running specials for previous patients for $180 for your renewal, and renewals for veterans are $160 right now. So, Dr. Abrams, we want to thank you, and please keep doing the great work you and Ohio Marijuana Card have been doing. Thank you. Bye-bye. See you guys.